Hey, it's Maddie Savage here. I'm about to teach you the skull.
And I'm Nina Palazzolo, and I'll also be teaching you about the fractures.
This is the frontal bone. Right in between the eyebrows would be your glabella. Where your eyebrow would be is the supraciliary arch. Right here where this notch is, that is the supraorbital foramen.
So there are 3 sutures on the top of the skull. Right here would be the coronal suture, separating the frontal bone and the parietal bones. Here is the sagittal suture, which separates both of the parietal bones, and here is the lambdoid suture that separates the parietal bones and the occipital bone. So the inferior temporal line and superior temporal line are not shown on the skull, but right here about would be the inferior temporal line, and above it would be the superior temporal line.
This is the temporal bone, the side of the skull. This is the carotid canal. This is the external auditory meatus. Right here is the foramen lacerum. And the inside is the internal auditory meatus. Right here is the jugular foramen. Right here is the mandibular fascia, right where your mandible connects. This is the mastoid process. And these little spiky things, this is the styloid process.
So there are 4 processes on the zygomatic, temporal, and frontal bones that you're going to need to know. Here we have the zygomatic process of the frontal bone. Here we have the frontal process of the zygomatic bone. Here we have the temporal process of the zygomatic bone. And here we have the zygomatic process of the temporal bone. Okay, so here are the alveolar processes, these bumps underneath the teeth. This whole section is called the body. Here is the mandibular condyle, and on the side right here is the condyloid process. Right here's the coronoid process. This little notch is called the mandibular notch. This right here is called the ramus. And these little holes are called the mental foramen.
This right here is the vomer.
Okay, right here is the lacrimal bone, and this little canal is called the lacrimal canal.
Hey, this is the nasal bone. This section right here is the maxilla. These holes in the cheek area are the infraorbital foramen. The palatine process is right in here.
Okay, so this is the ethmoid bone. This is how it looks, kind of, in your skull. This little point right here is called the crista galli. The whole top portion is called the cribriform plate, and all the little holes and ridges right here are called the cribriform foramina. This whole side is called a lateral mass, so this would be the left lateral mass. And this little yellow line down the middle is called the perpendicular plate. And the superior portion is called the superior concha, and the inferior portion is called the middle concha.
Oh, she just got me in my hyoid, the only disarticulated bone in the body. So this big hole is the foramen magnum. This little hole on the side of the condyle is the hypoglossal canal. And then This foramen underneath the hypoglossal is the condyloid canal. And for Nina's favorite bone in the body,
this little bump right here is the external occipital protuberance.
yeah, did you hear that? Protuberance! And here's Nina with the sphenoid.
Hey guys, here's the sphenoid.
Tell us.
This right here is the body of the sphenoid. This right here is the lesser wing of the sphenoid. Ugh. Here we have the greater wing of the sphenoid. Here we have the foramen ovale of the sphenoid. Next to it is the foramen spinosum of the sphenoid. Here we have the medial and lateral pterygoid plates of the sphenoid. Right here is the superior orbital fissure. This little hole right here is the optic foramen. This little surface right here is the orbital surface, also where your eyeball rests. Here, the little divot is called the sella turcica. Stop it. Okay. So on the sphenoid, along the side, we have the temporal surface, which you can also see on the skull, which would be about right here. And as we already pointed out earlier, this is the superior orbital fissure, and not shown on the sphenoid bone, but on the skull, is the inferior orbital fissure right below it. So, during an open fracture, the bone breaks and the skin is broken and the bone may protrude through, and it's the most serious fracture because the bone is prone to infection.
So here we're going to represent an open fracture. The paper towel being the skin and the stick being the bone.
So when it breaks,
It opens through the skin.
ouch! During a closed fracture, the surrounding skin is unbroken. It may cause swelling because of damage to internal tissue. So this is a closed fracture, the stick being the bone and paper towel being the skin. When the bone breaks, it's broken but doesn't go through the skin.
Look at that fracture.
There you go.
Green stick fracture. What happens to a green stick when you break it? As you just saw in the slow-mo video of the green stick breaking, it doesn't completely break off, making it a green stick fracture.
When an impact fracture happens, bone gets impacted in bone and it can lead to an open or closed fracture.
This veggie straw is going to represent the bone. This is an impact fracture. So this is the open fracture. This paper towel is going to represent the skin, and this is the bone.
It breaks.
What the hell? All right.